good morning again. Can I hear from you? Good morning. Yeah, thank you. I would like that everybody is fresh and ready to listen. Okay. So, PubHlth1 again. We are in the week 4. Please, just a reminder, you know, the week 5. There will be your presentations. I hope that you are doing the right communication in your public health team group. So far I didn't get any additional emails or anything like that. Maybe Jamie, teaching assistant, she did, I don't know, but it looks like it's quiet, so it means everybody knows what you are doing. I also wanted to share with you, please check also, there are a lot of links. Some of the links I mentioned to you, so please click on them. Some of the links we are going through the class. Some of the links are connected with your study guide for the midterm. We will still go week 5 through some of the public health news that you know, like how much information I need to know. So we will still have time on that, but I would like that if you can go through, especially like some of the links here and also through like the roadmap, because on the roadmap you have also information about links connected with the presentation, and you have the link already there. So for example, now when you click on the roadmap week 3 and 4, if we go through this, you have, and we will go through a few of the links here because we will be talking about polio and tuberculosis. So you have your links here. So if there are always the links written, you know, during the slides when I'm talking about that, so they are the excellent, they are the great sources connected with this. I didn't put that exactly on the slides because sometimes from the slides it's not working immediately. So like this one, you can click on that, or you can do copy and put that to the Google, so you will receive the information about the link. So that's one information I wanted to share with you. Also, as you can see, you have here book 2, and you have from chapter 1 to chapter 5. So it's much more, you know, your reading materials. And as I mentioned to you before, there will be probably 2-4 questions from this based on that public health profession. So from the book 1, from the chapter 1 to chapter 5, there is information about different public health profession. So it's like your little bit homework, reading this and finding like what is the basic information, what is the a description of the specific public health profession. So if you will see there, like for example, public health educator. So what is the role of public health educator? So this is the part that you will be partially like responsible for that. You have the textbook and you also have the slides. So I developed the slides for you. Another thing I wanted to share with you is, and you probably noticed that, you have audios. So there are also audios for each of that chapter, and you have the lectures here. So this is something what's happening just right now, that you are on that video. So this is, if you click on that, so there will be also videos on your, you know, on the lectures. So that you still have a lot of information how you can you know, review your materials. So if some of you are much more like the studying type, that you memorizing what's written and you know the text, you have very good visual memory, so then you can go through the materials through the slides. Some of you have very good you know, listening memory, audio, so then of course you are here, majority, I mean this is very good, all of you are here. I'm very pleased and I'm very happy for you that you are here. And then also you can review that again, that you can listen to, you know, to the materials again. So that will be good how to prepare, you know, for the midterm. So that information is here. When I was talking about the extra credit. So it's, as you know, the extra credit, it means you can go for the public health seminar, and it's almost like every other Monday. Now recently it was like every Monday, so you can go there and listen to the seminar, or each of the seminar will be also on the video. So you can, if you cannot go there because you have conflict with your class, so you can go on the video, click on this link. You can listen to the video from public health seminars and write at 150 words your opinion and your thoughts about that and everything, and put it on the digital Dropbox. So this is the extra credit that you can get to your final exam, and the deadline for the extra credit is, I believe, the week 10. So I don't know which, I think it's Thursday, probably last day of the class, or maybe the Friday I extended that. So you have to put it to digital Dropbox, okay? So these are all exciting things. And if you look now on all of this, your class website, so you almost realize like, wow, everything is here what I need also to have for the midterm. Remember, because we have next week is your presentations and partially additional information that we will be not able to cover during the week 4, plus a little bit like review for the midterm exam. So almost everything what is here today, what you can see on that your class website, is connected with the midterm. Okay, so I think it's good news. Yes, everything is in front of you. So let's go now to following chapters. Yeah, question.
I have a question about the midterm. Is it going to be short answers or multiple choice?
What is that?
Is the midterm going to be short answers or is it going to be multiple choice?
Okay, the midterm will be multiple choice questions and true and false. So true and false and multiple choice. Okay, so, and remember also sometimes when I mention in the class like, wow, you need to know this, if somebody will wake you up in the middle of the night, it's almost guaranteed that this topic and the question, some of the form of the question will be, on the midterm. Another thing, sometimes students ask me which way, we should study, or which way could be probably prepared, or we can prepare, or which way will be establish the questions. So think about that if it will be opposite. If you will be standing here and you would like, you are passionate about your topic, you love public health, what you would like that the people will know about that? So how, what kind of topics you will put, or what kind of exactly question you will maybe formulate, what you would like that from the people sitting here, you would like that you remember. What do you think it's really, really important? So sometimes, if you change the role, so it can help you in thinking like, wow, this is quite important for public health. This is quite important. So try also to do like a little bit thinking in the way, like, is this important or is not important? I know you will be thinking probably, oh, I don't want to study so much, so nothing is important. No, it's extreme, so don't think in that way. But really, like, seriously thinking like, is this important? Is it something that I would like that people will know about that? So that's another thing that can help you a little bit, like thinking which way and how much I should study for the midterm. Okay, and remember also, even I know you have the experience with other classes, like, oh, this is the midterm and everybody is in high level of anxiety and stress. So I would like that you will feel about midterm that what it's you are sharing your knowledge with your instructor, okay? So think about that. So here are the questions and you are sharing the knowledge, how much you know. Don't think like, well, this is my life, it's on that exam, on the test, because it's not true. I mean, there are different, very, very important things in the life. Of course, this is part of that, but not, I would like that you feel that in that way, that you are sharing your knowledge, and also the midterm is developed in the way that you still, even if you are here, you will learn something about that. So try to come with the good level only stress, like eustress, not because if you have eustress, so it means this is the good type of the level of the stress that will, it's like motivator, and it will help you to really clear, thinking clearly. If you have too much of the stress, you cannot think clearly, and you can forget many of the things, okay? So I hope you will enjoy the midterm. So we will talk about that after that. So chapter 10, remember last time we were talking about what was possible to do through public health perspectives, actually the achievements in public health perspectives in conquering, conquest of that diseases. Now we are talking about resurgence. So from this portion, you can see that still public health, it's very, very important. Some people would think like, well, we have antibiotics, we have vaccination, now we can, fall asleep in public health. No, we can't, because there are now suddenly new diseases are coming out. So this was like back 2006 information that suddenly this happened in Puerto Rico. So, and you will be probably hearing from time to time some information like that. Well, this is like diarrhea, or, it looks like epidemic situation. I didn't follow the situation. I don't know if they were able to find out what type of pathogen was connected with this, if this was bacteria or this was the virus causing this disease. But this is something that maybe it's not immediately clear what type of disease can be connected with these symptoms. So we have to be aware, like, well, how we can do surveillance for new diseases. Is there something how we can prevent from spreading the new diseases? Is it something that we have some additional laboratory tools that we can identify as quickly as possible? So they are the things that we need to think about that in public health. I know it's like a resurgence of the new diseases from your perspectives. It's already from historical point, like, well, it's almost like the old disease. But if you compare that to the diseases before that, we talk about yellow fever and we talk about typhoid and all of that, so it's actually the new disease. So this is the HIV/AIDS. If you look on the timeline, so that was first recognized 1981. Also be aware, and you already saw the video clip about West Nile virus, that some of the diseases are discovered just by accident, or just by, when I talk about accident, so it means suddenly from different way of correlation, maybe with the nature, with the animals, or sometimes it's discovered that the people are coming to the medical offices with completely different symptoms, and then you find out, well, these symptoms are actually connected or correlated with completely different type of diseases, so we have to focus on that disease. Very similar situation was with the AIDS and HIV. So it started with different symptoms. It started with Kaposi sarcoma, a very rare type of the cancer, that suddenly more people were coming with these problems, and it was necessary to find out or follow up and find out, well, is it something behind that? Also, it was like more occurrence of pneumonia. So everything looked like, well, there is probably low function of immune system. And based on this was the detective work in public health to find out what is behind this low function of the immune system. So this disease is one of that we have to be aware, one of that like new resurgence of the new diseases. It's also very important now when we talk about the disease, so you probably realize how important is something what you learned in the previous chapter about questions, who, when, where, and so on, and what. So because you would like to find out if a new disease is here and you have no idea. Now, if you compare 1981 with 2012, so at this moment we already know how we can probably do the primary prevention, how we can prevent the spread of the disease, or what is based on the laboratory test, what maybe it's behind that causing the disease, and also what is the transmission. Remember, we talk also about the chain of the disease, so now it's coming back this theoretical part that yes, what is the transmission? In public health perspectives, you need to know what is the transmission, because it's the first thing you would like to give this information to the public. Because, if we know quite clearly what is the way of transmission, we can prevent from, the disease from the spreading. So, of course, the first one was like sexual contact for the transmission. But then later it was discovered because there were people that they didn't fit to the category that was possible to find out and correlated what is the form of transmission. Now suddenly they found out, well, people that they have transfusions or they have the needles that were not clean. So now people got this disease also. Later it was like mother to infant, transmission of the disease. So there are many things that step by step now suddenly you discover like, oh, this is also another way of transmission. So it's very important to do the surveillance and to find as much as possible the ways that we can prevent disease from the spreading. Actually now with the mother to infant, so that was even recommended like to stop to do the breastfeeding because they were thinking like a few years back that through the breastfeeding it's also the transmission of the disease. Now it was possible to find out if the mother is on the therapy, the pharmaceutical therapy, and if the breastfeeding is done exclusively, so it means there is no break with the water or any solid type of the food almost until the 6 months or 8 months, there are no indicators that the disease can be spread. So it's very important because imagine that in some developing countries there is the problem with malnutrition of the infants, and if it looks like mothers cannot do the breastfeeding, so that will be the increase the infant mortality. So it's very important. Or also increase the infant mortality from diarrheal disease, because if the mothers are not doing the breastfeeding, they probably have the infant formula, and because it's expensive, so they are diluting that with the water, and in many of the developing countries the water is not drinkable, so there is the problem, with the diarrheal disease. So this discovery after like 2 years that was like not allowed to have the breastfeeding, and then discovering and finding this was quite important and crucial for developing countries. So this is, now you are thinking like, oh, from where the disease, of course you would like to find out what is the location or what are the etiological factors connected about the disease, because if you would like to eliminate the disease or decrease the risk of spreading of the disease, you would like to find out from where the disease is coming. If you look on that slide, information here is like, well, spread in human population due to disruption of traditional lifestyles, or also the changes, in the lifestyle or patterns in human society. So this is, or international travel. So this is another thing. It's very easy now, to move quickly from few hours, move from one country to another country, and we don't know if there is, transfer of the disease through the just international traveling. So that's another, I will have another slide to show you all the additional components that could be connected with increased risk of resurgence of diseases. So other emerging viruses, you probably heard about Ebola, monkeypox, hantavirus that was connected with New Mexico with symptoms of pneumonia, and it was spread through rodents. Then it's other hemorrhagic fevers. West Nile virus, it's one of them. So if there will be the questions, what are the examples of new, diseases, resurgence of the diseases? So this is something that, again, you need to know if somebody will wake you up in the middle of the night. What are the representatives for the new types of the resurgence of the new viruses or diseases? Another thing also from public health perspectives, we can learn from that diseases. We can learn like what we can expect, what kind of monitoring we are doing, how we are doing the prophylactic approach, how we are immediately trying to find out what could be behind, this disease, what is the spreading, what is the way of the spreading of the disease. So there are many, also if you look on that, some of them are spread also from the rodents. So if you look on the chain that I was showing to you in the previous chapters, so you know that you always have to have, of course, the human human being, that is the disease, the symptoms, but also reservoir, vector, environment, and also the pathogen on its own. So, but it's very important, remember, you don't need just to eliminate the pathogen. If you break any level of the chain, you already are decreasing the risk for the disease. So this slide is very, very important. If somebody will wake you up in the middle of the night, you need to know what could be the, behind the factors that could be connected with spreading of new type of the diseases. And if you look on that, is something, almost everything like so-called man-made. So the agricultural practices, international travel, I already mentioned that before. Also, sometimes people are bringing, therefore you can see like there is really surveillance about type of food it's brought to California, or just, from country to country to check that also, because some people are bringing the type of food, and maybe there could be some of that, maybe the virus that is normally living in the specific environment, and because it's living in that environment, it can just live there and not to do anything, but it's moved to different environment, and maybe it's increased the multiplication that is triggered by the different environment. So we have to be aware about that too. Some people are, traveling and bringing the exotic animals, and we don't know if they could have already some of the type of disease. And again, it's different environment that can maybe trigger the process of spreading of the disease. So it's very important to know that now, you future public health providers, you will be dealing with new type of the diseases. And when we talk, this is just the infectious diseases, but you will be dealing also with the chronic diseases. We will talk about that later. So another very important type of like resurgence of the diseases is influenza. Influenza on its own, it's a very tricky disease because the virus can mutate very quickly. So you prepare the vaccination in the spring to be ready for the fall, but it's not possible that you have vaccination that can completely 100% prevent the disease, because the virus through the time, through the another maybe 5 months, can mutate so quickly. So just some kind of portion can be influenced by the vaccination. So, but and especially it's good for people that they have low immune system, or they are exposed to many of that, through the environment, if they communicate with many people, or at the medical facilities, exposure to many of the people that is higher risk, that maybe I will be exposed to many people in communication that could be, spreading the disease. So that's the influenza. If you look on that epidemic, 1918, 1919, it's during the First World War, and this was, it's written here like worldwide, but of course it was, the majority was concentrated in Europe. Do you have any idea what could be the behind the, other etiological factors that they could lead to some kind of big, huge epidemic situation? I already mentioned to you, it was the First World War. What's happening in the First World War that maybe it could, could lead in that situation? Yeah. Yeah, that's you. I think you. Yeah.
Okay. While I was researching, I read that during the First World War, hospitals were being crowded, people were fleeing from their nations away from the war, and just the idea of being refugees, being in these large groups just helped, and going from country to country helped the diseases travel from person to person. And due to the war, a lot of the medical supplies went to the fronts instead of stayed with the people.
Yeah, this is excellent response from your classmate here. Yes, okay, let's do, thank you. Yeah, that was great. So I would like also that you as future public health providers, you always look on that like, okay, this is the problem, but what was behind that? Is it something that we can prevent that, we can minimize the effect of that? Also, if you look on that, the public health infrastructure was probably not completely in that way. Also, if you think about the First World War. So maybe there was generally problem with the hygiene, sanitation on its own. Also, that was not enough of nutrition in that way. And remember, the immune system, when we talk about citations or that wisdom from Dr. Osler and Dr. Koch also, how important is the environment of each of the person. So there was probably not enough type of like antioxidants and anti-inflammatory diet, everything what could increase the effect and function of the immune system. Plus, they even didn't know about that, because remember, the phytochemicals were discovered back 1980, multiple vitamins and all the vitamins on its own. I'm just joking about dietary supplements. Yes, multiple vitamins. So this was like 1950. So, and this is the First World War. So this portion was not discovered, but generally the nutrition also was not in the proper way, plus also high level of stress. So if you think about that, with high level of stress, increasing level of cortisol, decreasing immune system, not having the proper nutrition, plus all the problem with sanitation and everything, so it was actually leading with higher spread of the disease. So we have to be aware sometimes about that. And of course, it was the beginning of developing the vaccine that can also decrease that. But the whole environment is connected. So be always aware how can I prevent that. You cannot be always sure that yes, I will have maybe specific vaccine, or I will have specific antibiotics, or I will have just specific pharmaceutical tool that I can use. You can still provide some kind of improvement by the things that I was already sharing that with you. New bacterial threats. So this is something, when I mentioned especially the first disease, remember we talked about that, it received its name because that was during the time that everybody was at the conference in Philadelphia, and it was the problem of this the infection was spreading because people were staying in the same hotel and with problems with the cooling towers. So if you look on that, so we were thinking, oh, maybe now it was already conquered, but maybe if there is any little bit like break in some of the public infrastructure, the disease can occur. The same if it's like natural disasters, diseases that you were thinking, oh, they are just really like minimized or on special location. Now suddenly, because of that different situation, it can be spread, like cholera, typhoid disease, and all that. Streptococci and E. coli. So you still probably hear from time to time there was, problem with the E. coli in the food now, or the poisoning of the food. So now it's the problem that we have like new type of the pathogens, that some of them they are resistant and they can now just occur in the new environment. Streptococci, so that's sometimes, and some forms of staphylococci also. This is quite for this type of bacteria, it was very easy. It was already developed the antibiotics, but because how the antibiotics were used, so some of this, like streptococci, are also connected and still can occur in the hospitals, and they are quite, resistant for different type of antibiotics. Because we will talk a little bit about that later. What was happening with increasing the resistance of the pathogens to the antibiotics. So when we talk about bacterial threats, of course you would be thinking like, oh, we already have all the antibiotics, what's happening? The problem is that you can see here at the end of the slide with the antibiotic resistance. So what happened? How come we have that? I mean, we could be so proud and so happy that we have the antibiotics help us, to conquer the disease. The problem, what was happening is that it was misuse of that. So immediately, I remember like 20-25 years ago, so immediately if somebody has like even like a little bit yellow like discharge from during the cold from your nose, running nose and everything, was immediately going to medical office. and that was the prescription of antibiotic immediately. So what happened? Sometimes people, they started to feel good. They stopped to use the antibiotics, so it was not finished, the process completely to clean and kill also, the all bacteria, and overuse of that. So sometimes it was just preventative, thinking, well, this is the viral infection, and in case we don't want there will be additional pathogen sitting there, so we will just do preventative measures. But it was not necessary to do that. So if the bacteria were exposed to the antibiotics, they eventually developed the resistance on that. And so that was how we were using that. So it's man-made problem. Then you can see that agriculture. So what is the, the way of the farming? And you probably see sometimes when you go to San Francisco on the Freeway 5, did you notice, I don't know if any of you are traveling there, did you notice the farming, the cow, one cow is next to the next cow. It's not smelling very well on the way, but also I feel sometimes sorry to see, one cow standing to another one. And you already know if it's some kind of environment like that, it will probably increase, risk for any infectious diseases. So this farming is already done on the preventative measures to give antibiotics to the animals in doing the prevention of infectious disease. So if you travel to some other countries, I don't know, it's quite popular and it's always advertised. You see the cows in Switzerland, they are on the green grass and just running there and everything. So sometimes it should be something in the middle between that, so we shouldn't pack animals standing next to one. And you already see now also when you are buying different products, even the eggs you are buying, so it's like from animals, the chicken, that they are free of cage and all of that. So it's if you think about that, it's something that it's more natural way, and it's not necessary, to overuse the antibiotics. Here it's like, I put here example about the antibiotics used in Europe. On the general level, on the world level, global level, we have problem with resistance of antibiotics. But sometimes it depends also on some cultural aspects, how to use that. In European countries, it's just by the culture, the trend is much more for the alternative medicine. So that was by tradition, using first any type of the steps, starting with, taking care through botanical medicine, through sleeping, through the food to decrease the problem of the disease. So usually they were like waiting time of the period, and if the fever was not going down, then after a few days they were seeing the physician, and usually they were still monitoring that. So it was possible to stay at home, for the mothers to stay at home with the children and monitoring what is the progression of the disease. And if the progression after a couple of days was not improving, then the antibiotics were prescribed. So usually that was the approach, cultural approach in many European countries. So you can see by this, you can a little bit prevent, the risk of so huge resistance to antibiotics. Tuberculosis, you will see also today a video clip about tuberculosis and about the problem. I mean, many times you are thinking, oh, tuberculosis, it's almost like it was conquered. Now it's the resurgence of tuberculosis, because what happened? The same things what I mentioned with antibiotics, the resistance, and also what was the problem, because if you have the prescription of the specific medication and antibiotics, the regime of the drugs for tuberculosis, you have to follow that, and not just for 1 month. It's sometimes for 5 months, 6 months, or for 1 year, and also to see the medical facility to be sure that the person is free of tuberculosis. But then of course, it's quite expensive. Is it possible that everybody can afford that, especially in many of the developing countries? Probably not. So they started to be on the medication. So the pathogen was a little bit weak, but then they didn't continue. So if the pathogen was weak and not completely eliminated from the body, the resistance is possible to develop. So that's now, it's the quite scary situation, because how we we will be able to find out type of the medication that can really work from spreading, tuberculosis. So they are, and also if there is new disease like HIV, if there is any type of disease that is increasing immune system, it's very high risk for the person to get infected also with tuberculosis, because it's just the basic thing is it's increase low activity of the immune system. So just by doing this, remember when I was talking about immune system, how can you increase how can you improve the function of the immune system? Can you just tell me a few of things? I know you don't have that completely in your textbook, but I was sharing that with you. And I'm always telling you, giving you 5 minutes at the end of the class to improve your immune system. Just let me know, what do you need to do? Yes?
Vaccines.
Okay, vaccines. Okay, that's one. That's through the medical approach. That could be, yes, for the immune system we can do whatever it's connected with the disease, or IgG, so it's the immunoglobulins. It's like passive immunization to get that. That's good. What can you do on your own? Yeah.
Healthy diet.
Healthy diet. Okay, so then if you have antioxidants, anti-inflammatory diet, you can improve your immune system. What else? Exercise, yes. So that's very important. Please, I'm just checking that. I know you think like, oh, it's obvious, but people are forgetting about that, and it's very crucial. So yes, physical activity, you improve your immune system. Through physical activity, you increase a little bit temperature in your body, and that temperature, like a little bit slight above, not completely as a fever, but it's a little bit above, you can already kill the viruses or pathogens in your body. What else? So you are improving, helping the immune system. So we have food, we have exercise. What else? Yes? Sleep, yes. Okay. Remember, through the sleep, you are improving immune system. So, and we already have scientific justification. When I mention that now here, I know it's like simplified, but maybe some of you will be in my alternative complementary medicine class. Sleep is definitely, if you don't sleep enough of hours, you decrease function of your immune system. Okay, so we have food, we have exercise, we have sleep. What else? Yeah. What is that? Hygiene, yes, of course, that's very important, that you are not touching by your hands, your face and everything. Yeah, that's also, and hygiene on its own, like the whole public health infrastructure, that's important. What else? Yeah.
And stress?
Yes, what about the stress? What is that?
Stress management.
Stress management, okay, so what you will be doing? Meditation, yoga, what else? Very easy you can do.
Smile.
Yeah, of course, yeah. So this most important thing. Humor, okay? Humor therapy. It's amazing. Humor therapy, if you do really, mirthful laughing, just few minutes a day, you are really improving your immune system. So prescription should be for 10 minutes to have some videos or, some movies that you can really laugh. If you will be laughing for 10 minutes, it's amazing how all the components... Yeah, I know you are... Yes, that's good that you are laughing. Therefore, I was... I know you. It's very simple, and it should be something that we should be doing as a prescription. It's not yet, done, but I think maybe 20 years from now it will be standard that everybody will be giving prescription for laughing, and you will be thinking, "Wow, I remember that. I was laughing about that, but now it's the reality." So it's very simple. It's no side effects. What kind of side effects you can have from that, and it's cost effective too. And it's proven, there are research studies through many years, and if you check on the research meta-analysis, going through many of the research studies, connected the chemotherapy with different type of diseases, it's amazing how the immune system can be improved. So especially now, coming close to the midterm, so I hope you cannot completely do, probably, maybe you can do vaccination. You can, all of these other things that we talk about that, you can do. You can protect yourself if you follow all the things and not to get cold during the midterm. So almost everybody who is here in the class shouldn't have any cold during the midterm time, okay? Because I will ask you, if some of you will be sick, what did you read with your lifestyle? You already know what to do, okay? So this was a side, but I always feel like it's very important to share that with public health students because you are the new generation. So this is about tuberculosis. I already mentioned that about resistance. On the video clip, you will see that what is the problem, that you have to do combination of more different type of the drugs. Sometimes you add a specific form of antibiotics, but they have very strong side effects. So you have to add another type of medication to decrease the side effects. So it's really quite big problem now with dealing with tuberculosis, that is the resistance to antibiotics. Another diseases, I remember also when I was going back to the slide, like from the environment, or what is man-made, process is doing, that we are now having problems with different type of diseases. So one is the Creutzfeldt-Jakob disease. I remember this name when I was in medical school. That was like I was in, because we have 6 years in medical school, so it was the last year we have the practical experiences going from patient to patients, and there was one patient with some very, unusual symptoms with dementia, but also something that was not possible completely associated with any type of the form of the disease, because it was additional weakness of the muscles and very unusual form. And I remember all the professors were thinking what kind of disease, how we can classify that, and based on the laboratory tests and everything. And then I think after like 2 weeks, one of that professor came to us as a student and told us, oh, this patient has Creutzfeldt-Jakob disease. It's a very, very rare disease, and it was identified back in the 19th century. So it was like between 1860 1890 it was identified. So it was very, very rare, and nobody was thinking which way the disease could come. But of course now we know through the disease that the food that was used, that it was coming actually the components like when we talk about the disease like the mad cow disease. So that was the disease and the symptoms connected from the type of the food. How also, so you can see based on that how farming and the way of the farming and the way when we are receiving the nutrition is very important, because it's really influencing our outcome. So this is very important and it's important to do also the new regulations about that. So what public health needs to do in order to prevent occurrence and resurgence of the diseases. So this is the slide that, again, you need to remember. If somebody wakes you up in the middle of the night, you need to know that. So what is necessary to do? Of course, maybe new vaccination. You need also to improve the public health infrastructure on its own. It's very important to do the global surveillance. So that's very important. That needs to be done. But also, I mean, if you look at that, it's almost the same what we talk about, that to have the chain, how the disease is spread, and where we can break the chain. And I put it here, this portion, the future. You don't have that in the textbook, but now you are more and more aware about that. Like, we need to really improve immune system. We have to concentrate immune system, not just by the way doing IgG, using the immunization in that way, but in general terms. And if you go through the research literature, you find out all the components that we already discussed are connected with immune system. Bioterrorism, so it's another problem with resurgence of that infectious diseases. Here is the additional things that we have to find out who is behind that, like what is because it's the man-made process. If you will be thinking like how we are dealing with the disease, it's the similar way. It's infectious disease, so we have to follow the similar rules about that. But here is additional things like there is what's behind it, because it's man-made man-made process, so we need to do surveillance in that. Discussions. What are 3 public health measures that could reduce the probability that bacteria will develop resistance to antibiotics? If this question will be on the midterm and there will be ABC, and you would like to fill the ABC, or true and false, what you will write there? Yeah.
And the first one can start with education to the public on telling them even though if you feel better, please continue to take your antibiotics. And instead of just telling people, oh, take it all away, at least giving them a reason to help them think.
Yeah, okay.
Well, like a standardized, like procedure for antibiotics, because other countries are treating antibiotics like not right, so then people come in this country and spread the disease, and then we have this whole different strain that we never even seen.
Yeah. This is actually both of your classmates have excellent comments, and this one. So you can see here that we cannot just close the eyes and thinking, oh, it's our location here. We have to do some kind of education form and some kind of public health policy on the global level. Because it's in some countries you can just buy antibiotics like over the counter medication, and so if it's not enough done education that how long you are using that, or do you know. Also, another thing what quite disappeared, but it started, I remember when I was in medical school, there was always a laboratory test done, what kind of bacteria. And based on that was always, recommended a specific antibiotic. Now, it's like they are thinking, oh, the laboratory tests are quite expensive. We have some kind of bacteria with the wide spectrum, or we can, based on some of the research, we can predict that this bacteria will work on this type of antibiotics without doing the laboratory test. So this is another thing that it needs to be, as your classmate mentioned, to have some form of the public health policy on the global level. Yeah.
We could also improve like the cattle situation on farms and just like the living conditions for the animals.
Yeah, thank you so much. This is also excellent comment. So we have to be a little bit more educated, what should be the farming done also, because all of that things we are getting back to our bodies. So we have to be sure that everything is healthy around us. This is excellent. I like all your responses. So you are ready almost now. We are in the week 4 and you are ready week 6 for your midterm. Now, this is great thinking and great opinions. Thank you so much for sharing that with me. We are coming to the chapter 11. I'm trying to go through the chapters and at the end to show you the video clips. So, chapter 11 is talking about biomedical basis of chronic diseases. When we talk about chronic diseases, sometimes you can see the title chronic diseases or chronic degenerative diseases. Can you just name any type of the chronic diseases? The chronic diseases or chronic degenerative diseases is just a synonym. It's the same. So don't think it's completely degenerative. It means it takes time. Yeah.
MS.
Yes, it could be, for example, multiple sclerosis. Yes. What other diseases? Cancer. Yes. What is that? Asthma. Yes. Okay. Other. You probably hear that cardiovascular diseases. Yeah.
I was going to say heart disease.
Yes, heart disease, arthritis. So everything, the differences between infectious diseases and chronic diseases is infectious diseases is much more acute. It's coming quite quickly. You quickly need to solve that. With chronic diseases, sometimes when we talk about lifestyle modification and also to talk with patients and clients and with public about that, it means chronic, it's for the long period of time. So many times you don't notice that you are in that direction, having the problem with chronic diseases. When you look on this website, I also recommend you to go through all the website. You can see also the title is like American Heart Association, cancer, diabetes. So many of that titles are associated with the type of the chronic diseases. Many of them, they are developed as associations, and they are giving the support to the public if they need more information, about the type of the food they should eat, what type of the lifestyle they should do, or also many of them are supporting research in the specific field. So, chronic diseases, from the public health perspectives, the beauty on the chronic disease, I know it's bad, chronic disease, but the beauty on that is that it's multifactorial disease. So you have many factors. It's not possible that one will do and trigger the process of the disease. So, and also it's slow process. So if you look on that, from public health perspectives, if we start initiatives with primary and secondary prevention, we could eventually, based on this occurrence, how slowly it's going, we could eventually prevent many of the diseases. So therefore, maybe you have like surveillance, you have like the first primary or screening tests. But what is still missing, even we do the screening test for the colon cancer. So the patient is coming to the medical facility, having the screening test at age of 50, which is recommended for the colon cancer. So what is still missing, that if there is, everything is clear, no problem, the patient is sent home. Do you think it's missing something there? Should we do something additional with the patient? Should we just do screening? Okay, check, everything is fine, you can go home, that's it. Or should we do something additional? Yeah.
Monitor them?
Yeah, monitor. So it means monitor them also, probably what they are eating, you know, what is the lifestyle, anything like that. Yeah, that's true, because, you know, if you just go through the screening and you will tell patient, okay, everything is fine, you don't ask what is the lifestyle, what they are eating, you know, what is the stress level and everything. So it's quite almost, I would call it like the negligence, because I mean, at this moment, maybe there was no problem and the patient is sent home, but maybe it was still the window that even the patient, we don't know if the patient or the client was, you know, in the healthy lifestyle or not healthy lifestyle. So like your classmate mentioned, we should monitor that. We should probably check what they are doing. We should use that time when they are coming for the screening for additional maybe 30 minutes to do lifestyle modification, to find out what's going on, and maybe, you know, to check and send some after 5 months again, what are you eating, did you change your eating style or everything, because it's possible maybe there is the window that the person, maybe the person is healthy and everything is fine, but maybe the person really doesn't have any problems with the disease, but maybe that was the window that still the body was able to adapt, and maybe if the person is continuing in that unhealthy habits, eventually disease can develop because maybe low level of dietary fibers and so on. So yeah, so I like your approach. So I hope that you as a public health provider, you will start some kind of new approach, you know, with the public health policy doing this monitoring, because through the study you will see it's really possible almost 70-80% to do the preventative things with the diseases. So you can still improve the quality of life for the public. So, any of you were able to hear Dr. Dean Ornish? Nobody? You will actually hear him when we will be talking next time about the behavioral modification. So I will have like short video clip for a few minutes. Actually, the link is already on your class website, the whole 1-hour presentation about type of the lifestyle modification for disease prevention. So he's by training cardiologist. He has the Preventative Medicine Institute in Sausalito. He's taking the internships. So in case some of you are interested in that, it's San Francisco, Sausalito area, not so far from here. And he was known back like 1990 about reversing heart disease. So he was the first one as a cardiologist that he could do not only subjective measurements but objective measurements, because from your specialty as a cardiologist, when he implemented the lifestyle modification that was consistent of physical activity, stress management, and vegan diet. He recommended if you are eating the raisins, so the raisin, you should have one piece of the raisin and you should chew slowly on that couple of minutes. So, you know, because of the chewing and everything, you are using all the enzymes that you have in saliva, and you are absorbing in the proper way the good portions of the food. So also you don't need to consume so much of the food, because you are psychologically aware and using the enzymes to have all the food absorbed in your body. So he was able to reverse heart disease, because before there was always idea, well, when you start to have the trend for the cardiovascular disease problems, there is no way that you can go back. So he was able, through this lifestyle modification, that the veins where actually, you know, the cardiovascular system was clean from this building of the cholesterol and all the other components that they are connected with cardiovascular disease. So he did reversing heart disease, so that's his research, but also the textbook or the book. He also did reversing of prostate cancer. And he has enormous amount of different type of the books on helping also, that was the reversing of diabetes. So he was not reversed in the way, but completely managed. So it means that the person doesn't need to consume the medication. If we talk about the reversing, it means like the person is keeping the new healthy lifestyle. Sometimes you feel like, oh, it's the diet. It's not the diet. It's just the wellness, just the change of that, you know, eating behavioral and the whole lifestyle modification. So it is possible to do that, to be involved that and improve the quality of life, and not to, you know, doing the education instead of, you know, medication in public health, and decrease the problem with the side effects of pharmaceutical approaches. If we go back completely historically, Leonardo da Vinci, so he was known for his sculpture and paintings, and also he was philosopher. And in that time, he was already thinking like, well, what is the correlation with the sickness of the vein? So he was thinking in that time that is probably overconsumption of the food. So his recommendation was that you should eat that amount of the food that you can still comfortably, you know, stand up and move from the table and be still able to walk quite fast. And I know you probably can associate this moment when it's the Thanksgiving dinner. So, so this is only one thing that, you know, you can probably imagine that. But many people are probably that Thanksgiving dinner is every day. So imagine that, of course, if this will be my trend of my lifestyle, I will probably have higher risk for development of the chronic diseases, because it's something that the body is not prepared on that. It shouldn't be in that way. So this is just example to show you if you go through research, and I purposely pick up some of that older research literature, because if you think it's amazing, even like back 1997, there was studies showing, yes, it's possible through lifestyle modification already do the preventative measures in public health, or do the secondary prevention, so to decrease the symptoms. And if you look on the percentage, and because they try a little bit when we talk about the statistics and epidemiological studies, so they try to concentrate or to focus on one variable. So it means just not to combine everything, doing nutrition and stress management and exercise. If you look just because that there are so many of the factors working together, which is actually great, and it's something that should be done in the real life, but for the research they try just to pick up one. So if you look on that, it's amazing how much, you know, it's possible to decrease the problem or the risks with the disease. So, and this one you probably know, I'm not going back too in deep with this one, because it's about headaches. We talk about that with the epidemiological studies. This was the wisdom back from the actually 18th century. So it was the British physician. And sometimes I have, you know, the clients or patients with suffering from the headaches, and I ask what they are eating. And sometimes I'm getting answers like that. So I'm thinking, wow, this is the basic first modification that is necessary to do. And Norman Cousin, I don't know if any of you know, Norman Cousin, he was able to help himself also through the chronic degenerative diseases through the proper way of the lifestyle modification. So he was thinking like the pain shouldn't be ignored. We should really check why we have the pain, why we have the headache, what was in the lifestyle that it's giving me the signal with headaches that I should be aware about that. We shouldn't recognize headache as some kind of annoying part, but just think what we can do about that. So this is based, you already are familiar with the headache on that epidemiological study. I wanted to share with you. If you look on pain, especially the headache, we should recognize that as an early warning signal. If you look on that, usually the population, they are suffering from headaches until the age of 45 or 50, and after that, there are occurrence of chronic diseases. So we should be aware and check maybe that headaches as an early warning signal that can lead for development of chronic diseases later. Because if you look on that, it's common denominators there. It's not proper, healthy diet, no exercise, no, high level of the stress. So everything what is connected with the triggering of the pain for the headaches, it's actually connected as a trigger point for developing of chronic diseases. So it's quite crucial, and also it's very simple. So people think like, oh, it's so very simple, it cannot be true. But we have to be aware from public health perspectives. Many things, if they are simple, it's good to try that. So when we go to cardiovascular disease, we already know now, especially from Framingham study, correlations about some changes with LDL. If it's quite high, it's higher risk for cardiovascular disease. HDL, if it's low, it's connected with cardiovascular disease. Total cholesterol. When we talk about HDL, how you can increase that? By proper physical activity. So therefore, we need to have good components of HDL. If you are eating the partially hydrogenated type of the food or hydrogenated on its own, it's the chemical change of that structure that is in the plant oil, even if it's like margarine, so it's like partially hydrogenated. So what's this fat doing? It's increasing LDL and decreasing HDL. So you have to be aware about that. Cardiovascular diseases, it's what's connected with that, with the title, atherosclerosis, heart diseases, so high blood pressure. If there are first signs about that, we need to be aware and do something from public health perspectives. The numbers, when you look on this slide, many years back when I was in medical school, they still recommended 140 over 90, it's still fine. Now it's moved. It should be 120 over 80 or lower. Otherwise, it's higher risk for development of cardiovascular disease. If you look on that, hypertension, of course, it's connected with high consumption of sodium. If you look on any processed food, especially like different type of salami, just check what is the amount of the amount of the salt. You will be quite surprised that many of that processed food has high amount, because it's also keeping the freshness of the product and sometimes the taste of that. So mostly the manufacturers, they add it, if they have to decrease fat, they add salt or sugar to have the palatability, the taste or the palatability for the clients. Now I would like a little bit to talk about the vegetarian type of the diet, which way, how it's helping to prevent, development of chronic diseases. So this again, it's just, I was thinking to give you some kind of justification to show you some studies. And if you compare that, the group, if they are consuming vegetarian, but if we talk about vegetarian type of food, so it means it's balanced. Don't think that somebody will just like, okay, I'm vegetarian and just eating potato chips. It's not proper way of vegetarian. You will still have some little bit benefits, but you would be thinking like, well, it's not what I'm expecting. Vegetarian, it means really balanced diet with beans and fruits and vegetables and grains. It's not just like, oh, I'm refusing animal product and I'm just eating the chips. So if you look on that, it was possible, to decrease the problem with hypertension. Here the macrobiotics. Any of you are familiar with macrobiotics? It's just not the eating style, but also the approach to the lifestyle. So it's low level of the stress and meditation, yoga, physical activity. So it's connected with that. But if you think about that, it's already vegetarian type of eating. We have different forms. We have lacto-vegetarian, so they still consume milk, or lacto-ovo-vegetarian, so they consume also eggs. Or we have vegans that they are not consuming completely no animal products. Everything is from the plant nature. So evidence-based health benefits of vegetarian diet. So I would like, when there will be the questions on the midterm, is it possible, is there any correlations between vegetarian type of eating and decreasing the risk of chronic diseases? So this is yes, so that the answer will be true or false. So you will mark the true. So yes, we can see that all the components are connected and decreasing the risk of development of chronic diseases. Cancer, so especially because when we talk about this type of food, we are improving immune system. So cancer is one of them. What are the connection with that? Is of course the type of the food, antioxidative diet, anti-inflammatory diet. People are eating, more dietary fibers. And eating less of dietary fat and eating the omega-3 fatty acids, which is like immune enhancer. Caloric intake. If you look on that slide, it's an amazing slide. I was thinking I always need to show that to students and to the public. They are not realizing that. If you are really able a little bit to decrease the caloric amount, look on that, how much is possible just to do by decreasing the caloric intake. Starvation of pre-neoplastic cells. So it's something that you can really stop the spread of the cancer. So it's very powerful. Diabetes. So you already have the presentation about diabetes, so I don't need to go much more into detail. But also this is another thing, how you can decrease the symptoms of diabetes by vegetarian type of diet. If you look on that, it's from American Journal of Clinical Nutrition, back 2003. So it's already there. Why it's still not completely prescribed in the medical offices? Complications, you already know about that. Additional chronic diseases, Alzheimer's disease, arthritis, everything is connected with the lifestyle modification. If you look on the rheumatic arthritis, it's possible by vegetarian type of eating to decrease the problems, the symptoms. Cognitive decline. If you look on that risks, it is the cognitive function and memory also. Chronic stress is number one. People are not realizing that. So if you can a little bit eliminate or doing something about modification of your level of the stress, you will be able to memorize better the things for any midterm or any other classes, because the stress is actually doing opposite things. So it's no way to be in the stress situation or not worrying or not having that anxiety or fear, because if you eliminate that, you will be working much more efficiently with healthy type of the food also. Antioxidants, cognitive functions. This is something what I already mentioned to you when you will be preparing and studying to be involved in this type of the eating style, and you have a scientific justification. You can go just from study to study, and just find that. Very important information from position of American Dietetic Association and also from Canada. It was back 2003. It was really big change that was given the information or the position that vegetarian type of eating is healthy. And it doesn't matter if it's for young population, athletes, any type of population. It was recognized as a food that is the type approach is available and it's healthy for the public. You think like, wow, it's 2003, but before, if somebody would like to be, or child or teenager would like to be vegetarian, and the parents were worrying about that, they went to the doctor never supported that. Felt like, oh no, you cannot be, you don't have enough of protein and everything. So this was very, very important, because this means that if the parents are going with the teenager child, to the physician will should actually check what type of vegetarian diet, if it's balanced, and then supporting that because it's supported. So it was big change, in that approach. So now we are in the discussion question 1. How do epidemiology and biomedical science complement each other in improving people's understanding of chronic diseases? And then you have the video clips. So when you answer the question or ideas, what do you think about that? How it's going? Remember the Framingham study? Yeah. Yeah, you are. Okay.
It's always just
Well, that's great. Okay.
So by treating some of these chronic diseases almost as an epidemic, you can also find out the causes and initiate the same set of prevention and intervention in the same sense of, say, heart disease as compared to malaria.
Okay.
And so hand in hand, you can treat the chronic disease as a literally almost as an infectious disease and treat it and prevent it the same way.
Okay. Okay. So this is excellent. So I hope you were able to hear that, because this can be, on the midterm. So this is very important because we have the, epidemics of chronic diseases. And now I will show you the video clip about tuberculosis. There are few video clips, so I will just show you part of that.
In Lima, Peru, 29-year-old Raquel wonders why she is still suffering from tuberculosis. For years, she's been taking antibiotics, but she remains highly infectious, and her lungs are weak and battered.
None of my friends know that I have TB, because I'm afraid that they will say, just go away. I feel that if I am rejected, I won't be able to bear the pain, so I would rather not see them.
Raquel is used to rejection. Her husband left to avoid getting sick. Now, she and her son Bruno must depend on her elderly mother, and their future looks bleak. Nearby, Julia Giuseppe has also battled TB for years. Tests revealed her children are infected as well, but they haven't developed active disease. In fact, 1/3 of the world's population now carries the TB bacillus in their bodies, like a time bomb, waiting to go off.
10% of those people, about 200 million, before they die, will develop the active form of tuberculosis. The fact is, there are more people now infected with tuberculosis than at any other time in human history.
Fueling the rise of TB are the millions of people now infected with HIV/AIDS, whose weakened immune systems make them vulnerable. But that's not the only reason the disease plagues countries like Peru. In Lima, TB thrives in shantytowns like Caraballo, where tiny shacks cling to any patch of unclaimed rocky hillside. With impoverished families crammed into tight quarters, it's the perfect breeding ground for TB bacteria that pass through the air from victim to victim. Because the bacteria are constantly evolving, patients like Julia must take multiple drugs for months. And following the regimen is critical. As the drugs start killing the germs, many people begin to feel better and stop taking their pills. But a few germs are naturally resistant to the antibiotics. These survive, quickly multiply, and become the majority. Now, if patients restart their medicines, these resistant bacteria become tougher to kill. Because this was happening in Peru, in 1991, the government set up a program called DOTS, for Directly Observed Therapy. The premise is, if nurses make sure patients swallow all their antibiotics every day for 6 months, they will always be cured. And this was the fortunate outcome for most TB victims. But not all. In Caraballo, the crosses of people dying from TB began creeping up the mountainside as steadily as the squatter settlement itself.
Okay, so this was a little bit like introduction that you will see other links also. But if you look on that was something what your classmate mentioned, monitoring. It's very important to help the surveillance, improve the public health infrastructure. So all of that are part of this, public health case. So it looks like you are ready to do something for your improving immune system. Can you tell me what is that quickly? Smile, breathing fresh air, walking, and thinking about beautiful colors, fruits, vegetables, and grains for your lunch. Under this condition, I'm letting you to go, okay? See you Thursday.